sort of lineup today. We're going to be talking about physical activity in blue and green spaces and what's going on in that in Birmingham. We've got Dr. Gavin Passmore, who is involved with the Future Parks Accelerator programme, and Birmingham City Council. Is going to be speaking to us first, and then we've got mainly Gavin's going to be sort of leading the talk from the Canals and River Trust about the work that they're doing as well. I'm just going to just go to the next screen in a minute. I'm going to post a link in the chat just for our feedback survey. If you could fill that in, I'd really appreciate it. Any sort of feedback is greatly received. Also, in terms of comments and questions, you put those in the chat. Once the speaker is finished, we'll come to those questions and comments and put them to the speaker, and we can get those going forward, really. So without further ado, I'm going to pass over to Gavin to start us off, really.
Thank you, James. Let me just start sharing my slides. Okay. James, can you see that?
Yeah, I can see that. That's fine. Yeah.
Okay, so afternoon, everybody. My name is Dr. Gavin Passmore. I'm a GP registrar working with the Future Parks Accelerator group within the Public Health Division. So I've been doing this job for about 2 months now, and it's been a really, really exciting and innovative job that I've been involved in. It's something that I've not really done this sort of work before, because usually my work is in hospital medicine, and it's been pardon the pun, a breath of fresh air, and something that I've really, really enjoyed doing. So I'm hoping to kind of share with you guys some of the ideas that I've kind of discovered, and kind of share them with you about why green spaces and engaging in green spaces is really important with regards to physical health and mental health as well. So the first question is, what about you? And so I moved to Birmingham. When did I move to Birmingham? I moved to Birmingham last February. And when I moved to Birmingham, I was working through the pandemic, and I didn't really know much about the green space around me. But it's very, very interesting, actually, because if you look at Birmingham as a city, there's actually approximately, and I think this is a bit of a conservative estimate, about 571 parks and green spaces. Now, that compared to any equivalent sized European city is much larger. So we've got great natural capital, which we need to utilize, and we need to engage our citizens to help them get into those green spaces. Now, I wanted to use Mentimeter, but I unfortunately got the access to Mentimeter just yesterday, so I didn't include it in my slides. And I was going to be doing a bit of motivational interviewing with the group, and anybody who's familiar with medicine will probably understand how this all works. But I was going to say, in general, on a scale of 1 to 10, how important is green space to your well-being? And I think we've done this in some workshops previously with our groups in the FPA group. And what we've realised is that most people don't value green space in terms of well-being above an 8 or a 9. And when you think about that, that's quite surprising, because as I'll talk about later on, green space is so important to help us with our mental health and our physical health as well. But the key thing I'm going to put out to you guys, on your laptops at home is this. Think about this in your head. If you're thinking, for me, green space and its relation to well-being is about a 7 or 8, I want you to ask yourselves why it's not lower. And often when people ask themselves that question, they start to realize that green space is really important because a lot of formative memories are made there. A lot of great times with families and friends happens there as well. So there's lots of reasons as to why green space is quite important. So I think we always need to go to some definitions first and foremost. So what is a green space? Again, I'm a doctor, but I'm a big science nerd, and I think I put up this structure there for everybody to see. And I was going to ask people if they knew what this structure was. And I don't know if, James, if people can put their hands up and if they could hazard a guess, would that be possible?
Yeah, they could. You could sort of write it in the chat if that's possible. Yes, please.
Anybody know what this structure is?
Okay, I'm just having a look at the chat. Chlorophyll, as Katrina D said, chlorophyll.
Chlorophyll, yeah. So okay, so it is exactly that. Well, first it's a chloroplast which houses chlorophyll, which is when you look at green spaces and plants and trees, etc., the pigment which gives all green spaces that luscious, vibrant green look. And chlorophyll is really important because it basically transfers the energy from sunlight into food. So it's one of the most important things out there in nature. So that's a small definition. So whenever you see something green, think about the chlorophyll. But a green space could literally be a mound at the end of the road. And then, I know you're probably at home thinking, really, Jeevan, are you trying to tell me that a green space is just a mound at the end of the road? Well, yeah, I am trying to tell you that. I think a green space can be anything from a mound at the end of the road all the way to the parks that we all love to enjoy. And it's all about recognizing the value of that green space and saying that actually it's not just about going to your parks, and actually there's other types of green space which are available, which we need to utilize. And that's really, really important to think about. Okay, so before I put this up, the evidence, okay? So again, being from a medical background, and I've been speaking to a lot of my friends about the work I've been doing in the last 2 months. And the typical medics, whenever I tell them about what I'm doing, they kind of roll their eyes at me and they think, yeah, but Jeevan, is this just all kind of like hocus pocus, magic-y stuff? Does it have any actual tangible benefit? And as I've been doing the job, I've been unearthing more and more and more and more research, like so much research that it's you can't ignore it anymore. And I've been presenting this to a lot of my friends, and they kind of sweep it up under the carpet. But as time's gone onwards, and I'm just going to demonstrate here, there's so much research out there, so much so that it's becoming more and more overwhelming that you can't ignore how important and how good green space is for our physical and mental health. So the big three. First and foremost, physical well-being. So we're going to talk about that in a bit more depth in a second. But we know the evidence is clear, it's crystal clear that your physical well-being will be massively improved by engaging in green spaces. The second thing is mental well-being. And your mental well-being, whether it be the chance of developing things like anxiety or depression, generally feeling happy with your life, is all markedly improved by engaging in green spaces. And last but by no means least is the fact that we can use green spaces as a tool for social cohesion and societal integration. And I think that's something that we need to think about as well. I mean, prior to our starting this webinar, James and I were talking about this, and we're saying that actually a lot of the times, even if you make the argument for green spaces from the perspective of physical health and mental health, you need to make the economic argument sometimes and really sell that to people, otherwise they're not going to come on board. So the first bit of evidence I want to present to you guys is with regards to walking. So a brisk walk, what can it do for you? And when I mean a brisk walk, a brisk walk can be anywhere in a city space, but in a green space could be even more profound for you. The top three things, so cardiovascular diseases, diabetes, and hip fractures. For most people, that's fairly obvious. Most people would say, you know what, going for a walk in a park or and getting that 30 minutes of brisk walking every single day probably makes sense, that actually it will reduce all of those top three things. But when you look at the bottom three things, so bowel cancer, breast cancer, depression, and dementia, interestingly, people don't necessarily correlate that to physical, to getting out there and walking and improving your physical health. I was working with one of the environmental science students who's working with us at the moment, and he was helping me procure all this information. And he made the really good point. He said to me, Jeevan, you know what, actually, I mean, I knew obviously cardiovascular diseases, if you go for a walk, that would come down. And I knew diabetes would come down as well, and as would hip fractures. But I didn't know about bowel cancer. I didn't know about breast cancer. I didn't know about depression and dementia. And I didn't know that all these things could be reduced by going for a brisk walk every single day. Now, obviously, a lot of the evidence is not causal, it's correlative. So that's important to bear in mind as well. But if you look at those numbers, they're pretty significant, I'd say. Now, this is taken straight from the government guidance on how we should be doing physical activity on a weekly basis. So, I mean, there's two strands to this. So either we should be doing about 150 minutes of moderate intensity exercise per week, and that means kind of exercise like light cycling, walking, where you're able to talk to somebody, or 75 minutes of vigorous exercise. Now, I know all of us are keenly waiting for April the 12th, when the gyms are reopening, me included. However, we should start, especially with COVID, reframe the way in which we're trying to attain this physical exercise. Gyms aren't the be all and end all to get that physical exercise. Going into a park and going for a jog, or going for a cycle there, or just doing some body exercises there can equally be quite significant in terms of helping you with your health. And the overall ethos of all of this is trying to get people less sedentary. That's what we're trying to do. We're trying to get people off the couch, off the chairs, and moving. And that's really, really important. One of my friends who runs a physiotherapy business, I think one of his slogans is "movement is medicine," and that's absolutely true when it comes down to physical exercise. Now, this is a bit of a plug for some of the work that we're doing in the Future Parks Accelerator. And the plug is this. We sat down and, well, I say we, but it was before my time at FPA. I think there was some thought about how to communicate the importance and the value of green space and nature in general to other people. And the team came up with a brilliant idea. And the idea was to share some of our Earth stories. So obviously, as human beings, we love stories. We love to listen to stories. Stories are so important and so poignant and powerful to communicate different messages. So one of the things that we've done is we've created an avenue for people to collate their stories. And so this can be a video, it can be a short bit of prose, even poetry. So what I wrote was some poetry about why green space and nature is important to you. So if you can see the image on the right is actually an image I took, well, so I didn't take, one of my friends took when we climbed Mount Fuji in Japan about 7 years ago. Now, I think it was our 4th year of medical school. And that was a really great memory for me. And the reason why it was so great was because of so many things. So one of the things was that I was spending some quality time with 3 of my best friends. There was a certain challenge in climbing Mount Fuji, right from the bottom right to the top. And there was a certain degree of like numinosity, the awe of being in nature. And that was quite profound for all of us. Now, of course, Mount Fuji is like a bit of a spectacular example, but if you take it back and you distill those elements of what exactly is important about that experience, it can be found in your local park. It can literally be found in your local park, because if you share time with your loved ones in a local park, that can be powerful for you. And equally, if you you can do group-based activities in local parks as well, and that can also be very, very powerful for you. So all those things that I kind of found in Fuji, I think you can find them in local parks as well, which is really, really important. Now, for any of you guys out there who would like to get involved in something like this, I'm going to put the link there at the bottom. Please do send in your Earth story and why nature is important to you. I think it's a powerful tool for us to help communicate this message. So it would be really, really useful if you guys could send that across to us. And I've just put the link there, and I'll include it at the end as well. So now, in terms of mental well-being, now it's almost like an old wives' tale, isn't it? A lot of people say, if you're not feeling too good, you need to get out there. You need to get outside, get outside, get outside. And we say that a lot to people. But now there's not just kind of anecdotal evidence, but there's actually quantitative evidence about why getting outside really helps with your mental health. And one of the key things, looking through all these articles that I've really have been kind of a binding thing with all of this, has been that generally when people get outside and engage with the outdoors, we are much more happy, and there's greater degrees of life satisfaction. So people feel much more happy in their life. And I mean, I was thinking about this the other day, and just before the presentation, I was thinking, why is it that we enjoy being outdoors so much more than being indoors? And I mean, I think part of it is that the indoor environment is quite a contrived environment. And if you look at our species in general, we came from the African savanna, the plains of the African savanna, and that's where we feel most comfortable. So I think to some degree we have to replicate that in our day-to-day life, otherwise we will feel a bit disconnected. And it's really important to recognize that. And the infographic at the bottom that I put there about people generally being happier, reporting less amount of stress. I mean, COVID has been a great highlighter of this, hasn't it? Because a lot of people now, we talk about green flight, have moved to areas that are more rural, where they have access to these things. Now, obviously, that's kind of unfortunately been also exposed some of the inequalities, because people who can do that are usually people who are more affluent. But but we shouldn't let that be a barrier. We should be thinking about how we can make it more equitable for everybody to have access to these green spaces. And part of that is giving people the resources, tools, and also the knowledge to do so. So now just with mental well-being, not with physical well-being, we think that the time spent in green spaces is important, but actually it's the idea of feeling connected to the green space. That's the most powerful thing. And what I mean by that is when you're out and about in a green space, when you're there and you kind of take in all of those sensual experiences, so the sight, the smell, the smells, what you can feel, that helps you feel connected to your wider environment, and that's very, very important in helping you with your well-being. It's an idea called grounding, which is really, really important. And I'll signpost you guys to something quite interesting, and I really enjoyed reading it. There's a chap called Professor Miles Richardson, and he's done a lot of research into the idea of nature connectedness and how significant that is in terms of human happiness. And I would highly recommend you guys go onto his website and have a look. He also has done a little CPD course, because I know everyone out there is always looking to do a bit of CPD courses. I'm always looking to do that as well, to bolster my portfolio. And I put the link in that just here, so you can have a look up. All these slides will be sent out to everybody after the presentation. So the third pillar of this in terms of an idea, so social cohesion and integration. So we know that, again, it's fairly obvious stuff, isn't it? Trying to get people into green spaces, into parks, into places where we can communally come together is profound, because it helps people come together, forge bonds, and it makes people feel part of a community, which is really important. And people may argue that as time has gone onwards, today less and less people feel part of a community. But on top of that, there's so many good economic arguments as to why we need to be getting people into green space as well, because there's a massive contribution to the local economy as well, as I've highlighted in the first infographic. And there's overall just so many benefits for society when we get people into those green spaces. So I put this image in because it's kind of cute, and I liked it. And I think it's to represent the whole idea that there's been a paradigm shift in thinking, I think, with regards to how people see green spaces, see the world that we live in. We're all trying to become more conscious about how we interact with it. And that's a good thing. And I think we need to ensure that we continue that journey to do that, because the more we think about utilizing these spaces as tools for equity and for human happiness, the better it is. So my boss always kind of uses this beautiful image, and I really like this image. And I think a few of you will recognize some of these terms because they're quite in vogue now, but actually they're quite profound and poignant terms. Equality, equity, justice. What do these things actually mean? And at its heart, it's all about making society a better place for everybody. And that's the same thing with green spaces. We know from the evidence that the people who are the most disenfranchised, who come from lower socioeconomic backgrounds, who come from Black and South Asian and other ethnic minority groups, do not have the same level of access to green spaces that other groups do. And so part of our ethos and our motto is trying to make that happen. And if you imagine somebody over here with regards to wanting to access green space, and this is the green space, there are multiple barriers to it, and it's about recognizing what those barriers are, unpicking them, and helping people access those green spaces in a better way. Okay, so this is a bit of a slide about telling you what is out there, especially in Birmingham. So I've said not all superheroes wear capes, as we quite rightly know. So one society which does a lot of work with engagement in green spaces, and especially the idea of social prescribing. So social prescribing is the idea of connecting people together in these social spaces, a lot of times in green spaces, with link workers to help patients understand their health in a more holistic way. And TORS, the Active Wellbeing Society, do a fantastic job of this. And I think, if you guys haven't checked out the website, it's really important to just have a look and see what they offer, because they offer a fantastic amount for a lot of our citizens. The same thing can be said for the Friends of Park groups, and I think they are also doing quite a lot of work. And I'll allude to that a bit later on specifically about some of the work they're doing, which is absolutely fantastic. And then the last thing I think would be our own Future Parks Accelerator group. It's weird because before I came into this, I was not such a green advocate. I think they've really convinced me. Being involved in a lot of these meetings with my colleagues, what you realize is that there's so many people who are passionate about getting people to engage in green spaces more. In the FPA group, we're not just working with physical and mental well-being. We're also working with trying to understand how we can get more children into green spaces and more elderly people into green spaces. So we're looking at the problem from many, many different angles. So see that these are some of the opportunities that are available out there for different people. I think we have a website which is right at the top, Naturally Birmingham. Definitely recommend you guys having a look there. We have a newsletter which we release every month. And if you go a bit further down, so the Witten Lodge Community Association is a group which is quite dear to my heart. I work quite closely with them, and I'm trying to get some of their absolutely free events and ideas out there to GPs and different people. But please do either email Rob or myself. And Witten Lodge is a fantastic resource in terms of things like social prescribing and helping people to engage in green spaces. As I mentioned, talks, and Kieran is a fantastic resource. I believe he has something like 10 link workers who he works with, so he's able to signpost people towards these things quite well as well. And the last thing at the bottom is the Green Birmingham website. Anybody who's got experience in the public sector will probably know that often we have people working in lots and lots of different places, often on the same thing, but are not connected together. And this is our attempt to bring it all together and make the information quite concise and succinct so people can have access to it. Is there any questions?
Thank you very much, Jeevan. That was really fantastic, and it's great from my perspective as a GP myself, someone that's going to be one of the GPs of the future, having such enthusiasm about this as well. It's really great to see as well, and it was really well thought out talk. So thank you very much for that. Just got some really positive comments here from. So from your boss as well, and also from Jav as well. So thank you, Jav, for saying that was really insightful. Thank you very much, and I totally agree with that. Definitely echo that as well, and great information as well. So yeah, it was really nice overview that was. I just put a copy of the feedback survey link in the chat, so if you have to go off early or anything like that, I'd be really grateful for any of your comments, and obviously we'll feed that back to any of the speakers as well. We just got Katrina was saying Katrina's a GP in Solihull. They've created a greener practice Birmingham group for GPs to join. I think that's fantastic, Katrina. I'd like to hear more about that, actually.
Yes, please.
Is anything like that going on in sort of Birmingham that you're aware of, Jeevan, at all? Anything similar to that?
Well, I think a lot of it's in its infancy. I don't think there's any actual groups yet, but we're trying to put the networks together to bring people together. That's something that we're trying to do, but I don't know of anything that's materialized as of yet. But Hamira might be able to come in on that. So
yeah, Hamira is able to come in. Yeah.
Hi, good afternoon, everyone. Can you hear me okay, James?
Yeah, I can hear you fine. Yeah.
Brilliant. Well, fantastic, Jeevan. Such a good presentation. That I can hand over my job to you now. So, and yeah, really great to see so many people here as well. So well done, James, on getting so many people here. Yeah, so I'm Hamira. I'm a public health consultant and also the director for the Future Parks programme that Jeevan's given you a great introduction to. Just to say, you know, this is a massive area. It's almost mind-blowingly big in terms of how many people are involved, how many organisations are involved. We're about to hear from Gavin probably shortly on the whole blue space agenda as well, which is very linked to green spaces. So it's and not to kind of feel, I guess I would say, if you're hearing this, it can feel quite overwhelming, I think, in terms of thinking, well, where do I even start? I'm interested in a bit of green space. I know it's good for my patients, or I know it will be good for the people that I work with. You know, where do I start? You know, you've got a slide which hopefully James will share later. You know, you've got a list of people to reach out to. So please do use us. We're trying to work out, as Jeevan said, how to bring the system together. And that's the Green Birmingham website. So if you wanted to kind of join that conversation and help us design what that looks like, we've got some sessions planned for the end of April, which are all in the link that Jeevan's shared. So just to say, you know, we're a really friendly bunch, and we're here to learn just as much as we are to kind of share. So if you, and I think I can see Katrina's popped in the chat, she really wants to link up with you, Jeevan. So hopefully that connection can help to kind of, you know, spur some more stuff in Solihull and vice versa in Birmingham. So yeah, but a massive thank you from me to you all for coming, and to Jeevan for kind of, yeah, taking on the challenge of doing the webinar.
Right. So thank you, Hamira, that was brilliant, thank you. And yeah, Katrina, I think the idea of trying to green up general practice, I'm a massive fan of that. And I don't know if, you know, connecting, you know, us together, if you wanted to put your email in there, I could connect us all together, or you can email me, I can put my email there, so whatever you prefer. It'd be good to have some conversations. Oh, that's great, thank you, Katrina. Yeah, so I can coordinate all that together after that, so I think that's great. Just a few other comments from Suze G saying that was great, and doing a PhD on this up north backs up what they're saying in that, really. So that's really good, isn't it, to have that perspective, academic perspective on it. And then Emma was saying active partnerships, Sport Birmingham and Sync Active in Coventry, Solihull and Warwickshire are also advocating active environments and training social prescribers, and lots of other projects. So that's really interesting to note there as well. So there's a lot of exciting things happening in this space at the moment, and it's just trying to link all that together, really. What I'm going to do now is pass you over to Gavin, who's going to talk to us about the work they're doing, Canals and River Trust.
Thanks, James. Just bear with me while I share my screen. I'm working off a couple of monitors, so you might get something wrong to start with. Right, let's see if this works.
Yeah, that's fine. That's fine then, Gavin.
Perfect. Well, firstly, thank you very much for having me today. I also have a colleague that's hiding in the background somewhere, Ian. And I'll quickly introduce myself and ask Ian to do the same, but hopefully this follows on really nicely from what we've just heard, and I don't have to make the case for enjoying blue space in the city, because the evidence is very, very similar to that of green space. So my name's Gavin Passmore. I'm the Community Engagement Manager at the Canal and River Trust. I started here in August, so I've probably seen about as much of the canal network as anyone else has recently, despite working on it. And I think it's meant a lot more to me when I have accessed it, getting away from the desk and working from home. Previous to that, I worked for Sustrans, which is a walking and cycling charity based in Birmingham, but also covering the West Midlands. So for me, canals in my kind of private time are very much around walking and cycling, but hopefully through this role I'll get to see a whole lot more of what they can offer. I'm just going to bring Ian in to introduce himself as well.
Thanks, Gavin, and good afternoon, everybody, and thanks again, James, for getting us involved in this. It's great to finally become part of making sure we can get the most we can out of our wonderful canal spaces. I've been with Canal and River Trust for 16 years, and it's been wonderful to see a move in an organisation from what was very much an industrial transport engineering organisation to actually now being able to promote and really maximise the benefits that our reach across the region and the country have got. So it's brilliant to be part of this setup. So thank you very much.
Great, cheers, Ian. Right, as an organisation, Canal and River Trust, firstly, think about, especially in the West Midlands, we look after, manage, own anything you can get a boat up. So often people ask us about things like the Coal Valley or the River Ray. These are kind of out of our jurisdiction. They obviously link really well with the Canal network, but we've got probably I think the most across England and Wales and the West Midlands. Birmingham in particular has got a great reputation for having quite a large canal network. And one of the kind of main things that we're trying to tackle and work with and provide opportunities for are those kind of 1.75 million living within the urban canal corridor. So that's, you know, around about a kilometre either side of the canal network. And this is the kind of untapped population that don't traditionally use the canals. They might not know they exist. They might have found them in lockdown, either clearing the bottom of the garden or just taking a walk. So some of the things that we're trying to do at the Trust are just to raise awareness of the canal network, provide some positive opportunities for people, and to give them a taste of what the canals can offer outside of how they're kind of viewed either in a negative way or traditionally just thinking about them as kind of places to use boats on. As Ian mentioned, probably about 10 years ago, we came out of being British Waterways. So having started this job, say, I'll work for Canal and River Trust, and sometimes I get a little bit of a blank face, but when I mention British Waterways, people go, oh yeah, I know who that is. So we're trying our very best to get away from not only operating as a kind of landowner and someone that manages an asset, but an organisation that very much sees the waterways as part of people's well-being. And hopefully by providing and supporting well-being opportunities, we can help people look after and care for the canal network, adopt it where possible, build community ownership over that space, and help us and support us to keep the canals in its best condition as possible, and for future generations to use. They're a fantastic asset. I think that they're an amazing place to explore, and they're largely unchanged as well, in some cases over 200 years, and it's quite a unique historical feature. I think we're the third largest owner of listed property, so up there with the National Trust, etc. So there's fantastic things to see on the canal network, and they're often very, very close to where people live. They're not without their challenges. I think we're often faced with quite a fragile canal network that takes a couple of news articles to break down some good work or to build up a negative perception. One of the comments we often get is that people don't know how to get there. They often feel a little bit unsafe when they're on the canal because they don't know how to get on and off it. It often doesn't connect particularly well to where people use, and you know, there's a kind of, you know, perceptual barrier of whether or not they're clean, and you know, whether or not there's graffiti or some of the people they see on the canal. So these are all things that we're hoping to try and address through our work. I'm a big fan of the effect of natural surveillance. More people using a space creates a safer feeling environment. You know, one of the places that I live near, which is one of the future parks accelerator spaces in Cottridge Park, hasn't always been that way, and the abundance of people in that space now makes it feel incredibly safe, and hopefully that's something that we can see happen on the canals as well. One of our main focuses over the next kind of 18 months and afterwards as part of our legacy is around the Commonwealth Games, and that's a huge opportunity for the canal network. The picture before was Alexander Stadium, and at the moment it's probably the easiest place to see the development happening is from the towpath, but we've got a number of sites that are next to the canal network, and we want to see that canal network as part of that wider games facility. But we've also got things like the clean air zone coming into place, and the canal cuts often under the ring road into the city centre, and also something that we've been a little bit kind of split in terms of promoting is that we've seen a massive increase in certain places around canal use, up to 200–300% of users. This unfortunately has gone down in some of the city centre core locations like Birmingham, but you know, on other sections of canal in and around Birmingham, we found that a lot of people have been discovering these spaces for the first time, and very similarly to green spaces, the well-being and physical activity effects of that can be massive. Our tagline is making life better by water, but we very much and very firmly believe that life is better by water, and the calming effect that can have on people is great for mental health. So we've got the kind of space available. We are the landowner, and we're kind of up for creating new and innovative activities with partners and communities that live around the canal network. We have some constraints around some of the historical features, but through my role, we very much want to get our teams involved in co-creating activities and creating new things for people to do in that space. As I mentioned before, my kind of background is walking and cycling, but I think we need to keep in sight that the canal routes themselves form part of the walking and cycling network. They can often be part of the year offer, and I think in addition to some of the year-round facilities like the Blue Routes, they can give people a different experience of walking and cycling. And one of the things that we want to help do is try and create the canals as part of that play-space offer, as part of that community route, as part of the way that people navigate around the city. Social prescribing has been mentioned, and it's come up quite a lot in some of the conversations I've had recently, and these are very much kind of questions for people attending today. And by all means, throw some comments into the chat that kind of in response to these. But we've been talking quite a lot about social prescribing internally, as you know, everyone else is. And I think at the trust, you know, we've got that facility and space to use, and we want to see it fitting into social prescribing offers. I've spoken to James quite a lot about this recently, and how we start to pilot activities in the city. Through different conversations with link workers, we need to also think about where the best sites are. So often the canals in certain places are in a deep cutting, and there might be steps down to that bit of canal. It might not be accessible for people that are travelling there either by car or public transport. They might need to be near that kind of connecting point, whether or not that's an existing pathway through social prescribing or a GP surgery. And they have to be the most welcoming and good service they can have. So we're really keen to find where those kind of honeypot sites are that we can give people a new pathway through social prescribing. We're talking to a couple of partners about that. But it'd be really interesting to hear from anyone on the call now if there's you know, a role for canals within their work, and also if there's anything that's come up that's stopping people accessing the canal network. I can't see the chat box at the moment because of the way that I'm sharing it, but if anything pops up, maybe James, where you can kind of flag it.
Yeah, we'll do, Gavin. Yeah, we'll do. Yeah,
do that. But we're really keen to hear, you know, from professionals like yourselves about what else we could do on the canals to provide a better offer. If there are any specific locations people would like to see things happening in, and thinking very much not just about the canal towpath, but also about how we can use the water space, whether or not we can get people on the water with canoeing, kayaking activities, or you know, the restrictions allowing out on some of the boats that we also own. Just pause a second.
Someone in the chat box there, Katrina's come up with a comment. How do you get access to paddle boards, and how could that be improved? You know, that kind of thing.
So we do paddleboarding in a few different places. It's one thing that I've been talking to a couple of providers about, because it's quite a unique experience, and it's something that I want to see on the water in Birmingham. It's also something that we can provide free of charge through what's going to be our Let's activity program. and also working with partners such as the Roundhouse, which is a new National Trust partnership with the Canal and River Trust in the centre of Birmingham, to create an opportunity for things like paddleboarding tours or activities and taster sessions. We can also look at how we can start to do things like litter picks on paddleboards and canoes, and that's something we're really keen to do and get communities involved in.
Great, thank you, Gavin. So I've got the chat up now. I think maps has been mentioned. I think that's a really key point, and it's something that's quite simple in terms of current access, and also what the surface quality is like, access points, etc. I think we're linking in where possible to some of the Commonwealth Games sites, and that's where the majority of our access improvements are happening. But mapping is something that we're looking at with the public health team at the moment, and how we code maps to work with communities so they're fit for purpose. So we're just doing some rebranding of some city council maps at the moment that were done through the Birmingham Cycle Revolution, and then we're going to look at how we can create some more bespoke ones for particular areas, maybe linking into social prescribing to show not only what the facilities are like, but possibly some of the things that people can see along the way. So kind of building on that, with social prescribing, we're looking for, I guess, what you'd call the quick wins, which are wherever we've got existing offers and link workers that we can just provide this new facility, which is the canal. So how do we support people to do that, either through education on where the access points are, where the canals lead to, where the additional facilities are, how can we provide maybe a different opportunity? Could that be paddleboarding or linking up to another organisation? And then also, how do we develop something new on the canals? And this is something that we've been talking to James about. Often it's as simple as you know, a mapping exercise or creating you know, a specific health walk along the canal. But it's going back to my point earlier about making sure it's in that right location, that it's as accessible as possible, as friendly as possible, and that there's staff there to support that process and integration with the canals. And we're looking very much at picking kind of pilot activity in a few places around the city. So what could we do around the kind of Perry Bar area, maybe linking into the conversations we're having with Whitton Lodge? How do we use the kind of underutilised space on the Grand Union Canal and some of the facilities we have up at Ackers and some of the great work that's happening in the east of the city? I think that the south is probably the most well-used bit of the canal at the moment. However, down towards Kings Norton, there's been some work that's done previously and out towards kind of Brownwood, where we could really build a much stronger offer there. And then there's always going to be a need for us to promote some of the kind of high-profile routes along the Wolverhampton main line, out to kind of Icknield Port, but also working with the communities around Ladywood and central Birmingham. That's a really good kind of point, Raj. I was bitterly disappointed when I started that I wasn't able to get onto a boat, because we have a really good scheme of boating buddies for new starters. But I think you know, we're talking a lot about kind of physical activity, but also getting people out on a boat trip is a fairly unique experience, giving them a taste of the canal network, but also thinking about how we can work in things like fishing and other activities that aren't as active, but also give people time and space on the canal network. As mentioned before, the kind of maps are a big part of what we're looking to do, but also, especially through my work at Sustrans previously,
assuming that giving someone a map a particular scale is going to work isn't always the right way. So we want to work with community groups and find out what's most useful for them, what they want to know, where they want to go on the canal, and then think about how mapping can support that and become one of the tools that we use to get people involved in the canals. A lot of what we're doing is to kind of tackle some of the things that I talked about at the start, which are the challenges, and that's an awareness of the canal network. One of the big kind of things that we're pushing forward with is how we create a community ownership of the canals. We have issues with things like fly tipping, littering, graffiti. So how do we turn those into more positive spaces that people feel like they want to use, want to own? And volunteering is a big part of that, and that's hopefully how we can lead into, you know, social prescribing, from early kind of activities on the canal to thinking about how people can get involved in, you know, a lot of our volunteering activities that happen on a daily basis throughout the city. And our volunteers are the kind of unsung workforce of the trust, and we're really keen to build and also make sure that volunteer network is as diverse as it can be. Through the Commonwealth Games offer going forward, we're going to take a big push on trying to increase our urban volunteers. We've got some great support in more rural settings, but there's still a lot of work to be done in cities and urban areas around the West Midlands. And hopefully the other things that we can build on are, you know, how we can involve younger audiences in the canals, and how we can also bring other stakeholders and partners in to use the space, you know, in a way that they see fit. I'm going to leave it there and just kind of open up if anyone's got any questions. If there's anything about the canals themselves and locations, Ian's your man because he knows them inside out, but also he's leading on our work with the Commonwealth Games, so he can maybe talk about what we're doing around the game sites, but also as an organisation, how we're kind of working with the game sites, but also the City of Culture this year in Coventry.
Great. Well, thank you very much, Gavin. That was a brilliant talk, and just shows you the opportunities out there. There's so many opportunities, isn't there, to you know, to move things forward. And I was a privilege to work with Gavin and Ian on some of the ideas that have been discussed today, actually, and some really fantastic potential benefits to people. I think are quite huge, actually. I didn't know if there's anyone's got any comments, or Ian wanted to mention anything, just open that out really to people. There's a comment in the chat box there, Gavin. I don't know if you can see that.
Yeah, so the work with the Commonwealth Games, and Ian, please butt in at any point and correct me when I go off on a tangent, but so the work we see around the Commonwealth Games is site specific to start with, so the area around the Commonwealth Games site itself, so Rico Arena, Perry Bar, City Centre, but the kind of secondary and really important part of that is the connecting canal that takes you from somewhere like Solihull into the city centre, or from parts of Sandwell up to the Aquatic Centre as an active travel route. Obviously, in somewhere like Solihull, we're bound by where the canals actually are, and often in Solihull, the challenge is that the greatest area of need to increase physical activity and work with communities is often in the north of the borough, whereas the canal network is predominantly in the south and then moves into a more rural setting. But we're happy to work wherever there's a canal network, but at the moment the big focus for us is the kind of urban areas and also where the Commonwealth Games sites are.
Gavin, if an organisation or a group, because I know it's been mentioned, you know, in the chat here, you know, a really great idea actually for that Raj mentioned about sort of elderly people doing activities on the canal. If someone approached the Canals and River Trust and said they had an idea or a group, or you know, would that be something that you would sort of welcome any sort of collaboration like that if people did have ideas? And
Yeah, definitely. We have a few kind of bread and butter opportunities that we do. So we often have community groups or different organisations coming on to help do volunteering days. We have a few heritage working boats, which are older boats that are still in the same kind of condition that they were before, and you see those out in events. But I'm sure we could create opportunities to use those for boat trips as well. We also have a boat that's been converted into an outdoor classroom, which is moored up at Ignore Port at the moment. And that's going to be used where we don't have a particular site, yard or facility next to the canal, that school groups can come down and drop their stuff on there and use it as a bit of a classroom opportunity. Katrina, Men in Sheds is something in every job I would love to get going, and I think there's a great opportunity for an intergenerational opportunity there as well. We've got loads of opportunities around the kind of I guess building stuff, fixing stuff, because with our structures being so old, that happens all the time. But also we've got a lot of places dotted around the canal network, which are buildings that we own, that we work out of, that we could kind of repurpose and do activities in. So we've got a facility up at Perry Bar that we're looking to kind of transform into a bit more of a physical activity hub, but there's enough space there to maybe do a kind of bike maintenance workshop, and that could feed into Men in Sheds, or we could do a kind of men's mental health activity program like that anywhere on the network, and it's something that I'd be really keen to see get going on the canals.
Oh, that's great. That's great. Sounds very interesting, all of those ideas. So,
but James, I'll pop my email address in there. If people do want to get in touch with me afterwards, I'll recognise a few names on the call today. But I'm probably the kind of first port of call, and then there's a few people in my team that I can kind of pass you over to, or if it's something that I'm already involved with, we can have an extra conversation about it.
Great, thank you, Gavin. Appreciate it. I'm just going to share the screen just to bring up just a bit of a taster of what we've got coming up, really. So just get rid of that just for next week. But thank you very much for all of the speakers today. Some really interesting presentations and discussion, and thank you for everyone's comments today. Really appreciate it. It's really been fantastic. I'm just going to bring up this a minute. So just skip this forward a bit. So next week we've got another webinar in regards to physical activity, cardiovascular health and diabetes. So we've got a really good lineup. We've got the cardiac rehabilitation team from Birmingham Community Healthcare Trust, and they're talking about different cardiovascular conditions, and physical activity is a real focus there as well of their work. We've also got Dr. Parthen Hendren, who set up XTOD, which is a website and a community promoting sort of physical activity in people with type 1 diabetes, which should be fantastic. And Ewan, who's someone that Gavin and myself work with, who is working a lot really with physical activity, and particularly relationship to type 2 diabetes. So it should be great. So it'd be great to see some of you there if that's possible. And obviously we really appreciate your feedback, and there's a link in the chat. All of the webinars will be available. So all of the webinars so far, so this is the 7th webinar in 11 webinar series, is available on the Healthy Brum channel. So thank you very much for coming today, and it's been great. Thank you.